The month of October is normally set aside for our women, our beautiful ladies, our mothers, just to create awareness concerning the breast cancer. You know, cancer is a killer, and
hello guys, once again welcome back to the Gatekeepers TV. Of course, I'm your super host at Dennis Keton. Welcome to the health segment show. This is whereby we bring to you anything health related, and we actually strive to educate you and empower you on what's happening in the healthcare industry out there. Before we start the show officially, allow me to introduce my guests and my colleagues on the show today. I'll start with my far right.
Hello guys, my name is Robert Ogada, member of Care Medical Professional Association Group. Thank you.
Daktari.
Hello guys, my name is Silvana Somondi Adede. I am an optometrist by profession, and I'm a member of Care Medical Professionals Association. Thank you.
Thank you so much, my colleagues, guys. Today we are here as friends and also as professionals. Also speaking to you, of course, I'm also a member of Care Medical Professional Association. So today we are here just to create awareness. Today we've been going around visiting our members in their various practices, trying to see what they're doing for the general clientele or patient outside here. So today we are happy and we are honored to be hosted at Hillcrest Opticians, basically. So Hillcrest is a facility which is owned by our very own Silvanus Adede.
Yes.
So us being the visitors here today, I want to give him an opportunity to first of all give us just a brief of what Hillcrest is. Of course, I know you can see from, of course, the general setup of the place, but let's give him the honors to introduce Hillcare and tell us something about Hillcrest. Daktari, karibu.
Asante sana. Thank you so much, Bwana Secretary General. Hillcrest Opticians was started. We started Hillcrest Opticians in the year 2018, May 2018, and I'm the founder of Hillcrest Opticians. Majorly, we focus on primary eye care of the eyesight, where what I mean by that, we do refractions, we do dispensing of the spectacles, we also do foreign body removal. Those are key services that we do. We do also treatment, eye-related treatment for people who have, let's say, maybe screening for cataracts, screening also for glaucoma. We also do screening for what we call refractive errors. So Hillcrest Opticians, majorly we focus on primary eye care treatment for eye-related problems. What I mean by that, we focus on things to do with refractions. If a patient walks in and he or she has a problem with the eyesight, what we do first, we have to check the vision of that patient. If we confirm maybe the vision is not something that maybe we can treat from here, that is now we refer that patient to a different facility. So Hillcrest Opticians, we normally our main key is refraction, dispensing of spectacles, removal of foreign body, and minor surgeries.
Thank you so much, Daktari. There you've heard it. You've heard Daktari mentioning a lot of things regarding eye care. So I think I'm going to throw this question back to you. Today you are hosting us here in Kitengela.
Yes.
Can you gladly tell us, here in Kitengela, what are the top 3 eye challenges which you experience in your facility?
Thanks so much for that question. The most common eye problems that we get around this place is eye allergies because of the environment. We also have cases of glaucoma. We also have cases of refractive errors. So most common diseases that we normally get in daily basis are eye-related allergies, glaucoma, refractive errors, and cataracts. Yes.
Thank you so much for that. So, Daktari, one thing which actually motivated us to come actually and have a sit down with you today was we've seen you in various ventures, especially in ventures which involves giving back to the community. You've been so much involved in programs which involves giving back and actually going to those vulnerable places and rendering back your services. Can you tell the viewers today, what is usually your motivation? Why do you engage in such community activities, whereas you could spend your time here in this facility and make money?
Thanks so much, Bwana Mr. Dennis, for that good question. You know, giving back to the community is a way of, it's a gift. It's something that you do with passion. And because of that, we normally tend to work in the community and get those people who have problems, and those people can't run to someone for help. So the reason why we do this, we realize when you go closer to people, that's where you will find people who have got problems. You will find there are so many children out here who have problems, but they don't know where to run to. There are hundreds of children, we call them, most people, they have different problems. Maybe they can't even have books to study, they can't even have good desks to study, they can't even have proper medication. So the reason why I tend to just have that discussion with other people and also engaging with other people is because giving back to the community and especially to the society is something that you do it not just because you want a blessing or what, you do it out of passion and you want to help people who are the vulnerable people in the society. Those people don't have where to run to, they don't have any place to call home, so we visit them, whereby we go there, we do free screening for them. If we identify people who have problems, let's say in the eyesight, we normally make arrangements with other stakeholders that we work with to have reading glasses for them for free. And we also give them free medication if we go there. So our main focus is just to see these people smile and just ready to learn when they have the good resources. So our main focus, normally we just have to make sure that these children, they don't have a problem with eyesight. So number one, we normally make sure that we do screening to identify those children who might need any other support outside there, and there's someone who is willing to give those supports, but they don't know where to run to. That's where Hillcrest and other stockholders, we now come in and now make it easier for those kids to have somewhere they call home. Thank you.
Wow, guys, what a better way to find a place whereby you can bring your people, your patients, and they can live out of this place with a smiley face. The only place you can actually come and get such services, guys, is actually on top of the hill. We call it Hillcrest. And of course, when you come here, Silvanus will be the one actually attending to you, and you will leave this place a happy person. We will come back to you again, Daktari. Yep. So guys, as you can see, we are three here. There's one of us here who's not been speaking, but it's intentional. So let's jump straight to him. Today we wanted to tackle two topics, one of them being today or this month being October. It's a breast awareness month. As you can see from the poster which he's actually holding, he's actually holding a poster for breast cancer awareness month. So I'll actually allow him the honors to tell us why he's so passionate about this and what are the key factors which we need to be on the lookout as we observe this special month for our ladies and women in our life. So, Robert, karibu.
Wow, thank you very much, Mr. Secretary General, and also I commend my fellow member.
Oh, thank you
for very good work you are doing at Hillcrest Opticians. A very wonderful place to be.
Asante sana.
So, yes, today is Breast Cancer Awareness Month. We are creating awareness concerning the breast cancer Then the month October is normally set aside for our women, our beautiful ladies, our mothers, just to create awareness concerning the breast cancer. You know, cancer is a killer, and we won't give cancer a chance to take away our daughters, our mothers, and our ladies. So this month we are just guiding, we are just providing to our ladies, our moms, on how to eradicate breast cancer. One of the ways we recommend people to go for the mammographs, or we call it mammography, where there is the use of X-ray or the low energy to check where there is any growth in your breast. Number two, we recommend ladies to do a self-check at the breast. So this is where a lady, you can just stand on the mirror and check, just palpate the breast and check where there is a lump in your breast. Then number three, you can visit any health facility for a clinician to check on you, just to do some medical examination to check if there is something wrong with your breast. So this breast cancer awareness month, we are dedicating to all our ladies. We are doing this to most of our associates. We know as Care Medical Professional Association, we have several facilities. We have pharmacists, we have a clinician, we have medical officers, and these our members, they have facilities in various parts of this country. So we are creating awareness in each and every facility we are visiting right now concerning the breast cancer. So Mr. Davis, those all we are doing right now, and you can see I've worn a pink. You can mistake me why this man won a pink cap.
Cap.
Yeah, a pink cap. Yeah, you call it cap in German.
Yeah.
Thank you. But today, please, this is the Breast Cancer Awareness Month. Please visit any health facility around you, because most of the guys who are doing ultrasound, like for example, Gione Ultrasound, they are doing the mammograph at a very affordable rate. Please, ladies, visit the nearest health facility and get checked about the breast cancer. Early detection leads to eradication of breast cancer. Thank you very much.
Wow. Guys, it can't be more informative and more elaborate than what Robert has just elaborated and explained on the show. So the key message outside here to all our ladies outside there is screening, screening, screening. So whatever you do, no matter what you're going through, screening is mandatory. As he just highlighted, we always say prevention is better than cure, and if you do that, it's gonna be impactful. Also, one thing which we need to mention is this: we are not only concentrating on those people who don't already have the breast lumps or the breast cancer, we are also advocating for the society to embrace even those ladies who already have been diagnosed with breast cancer. We need to provide a safe space. We need to provide a safe environment whereby our ladies or these ladies feel accepted. Medically, we always say this: the moment psychologically you are embraced by the society, it always helps you psychologically to heal very fast. So let's provide such an atmosphere or an environment for our members, and it's gonna be something very powerful and very impactful to the general community. So guys, as we continue to wind up on our show, there is something also which we need to talk to you guys about. But before I talk about that, allow me also to, we are still talking about Breast Cancer Awareness Month, and what a better time and a better space to have this conversation with, of course, a lady on set. So before we even talk much, allow me to hand her over the microphone so that you can actually know who our guest is on set. So please tell us your name.
Hi everyone, my name is Magdalene Mudhama. Yeah, and I'm honored to be here today. Yeah.
Maybe tell us, what do you do, and why are you passionate about this campaign of breast awareness?
What I do, I'm a networker. I do network marketing. with a company from the US that is called BF Suma. Some of you might have heard about it. So we deal with alternative medicine. Yeah.
Nice. Alternative medicine basically is the way to go
Sure.
in this new generation of the new trends of medicine. Yeah. Today we are basically talking about October, the Breast Cancer Awareness Month. As you know, most ladies outside here always find about breast cancer maybe at the third stage when they are almost dying. Today we are here to just remind ladies and to use you also as the ambassador to just remind them of this special message. So please talk to our ladies. Can you help them know that screening is one of a virtue which all of us are actually advocating for? They will hear it better when it comes to you. So talk to them.
What I can encourage every other lady out here is to go for the early detection of breast cancer. Like for myself, I went for it yesterday, and I would urge everyone to go for it because it's of importance. Yeah, October being the month of breast cancer awareness, it's important to visit a healthcare professional for the screening, and you can reach out to the Care Medical Professionals Association, the CAMFA, for more information about that. Yeah.
Thank you so much. It's been our honor to host you on the show, though it has been short-lived, but hopefully you've enjoyed being on set, right?
Sure, I have enjoyed.
Thank you so much. Hopefully we'll have another sit down with you next time.
Okay.
A more organized setup so that you can actually tell us more about your program and what you deal with in regards to alternative medicine. So feel free to invite us anytime you have that opportunity. That's okay?
Yeah, that's okay. Thank you too.
Allow me also to take this mic back to Silvanus. Silvanus, what do you have to tell our members regarding Breast Cancer Awareness Month? And in your own capacity, are you having any specific thing which you are doing towards the same?
Thank you so much, Secretary General. In regards to breast cancer awareness, normally we get patients across the world, people who have different problems. So what we normally advise them is just for screening. And in screening, just to you can walk in a facility that offers those services. You get checked. Then the best way to do that is just walk to a facility, have a discussion with a clinician, and have yourself checked for breast cancer. That is what you normally. It's just to advocate for that.
So guys, in summary, screening is very basic and it's very important for all of us. So as we wind up the show, guys, this show today is brought to you courtesy of Care Medical Professional Association. As you can see, of course, the billboard is there, and the members are all branded with CAMPA colors and logo. So guys, you might be wondering or asking yourself, what is CAMPA? Who are CAMPA members? So CAMPA is an abbreviation for Care Medical Professional Association. So basically CAMPA, this is a group of healthcare or medical volunteers who have come up together under one umbrella, basically to give back to the general community with services which entails free medical camp. We also do mentorship programs. You will also find us going back to the vulnerable places in the community, trying to mobilize for maybe foodstuffs and such stuffs to give back to the community. Also, we are envisioning to work with the government. By the way, Ministry of Health, we are actually calling upon you. CAMPA is the place to be. We welcome partnership with you people. If you need a group who can easily mobilize for you members or healthcare practitioners or providers to champion your campaigns, then you might be looking at CAMPA. We are actually closer to you than you might think. So we are actually calling for you to look for us, or we will look for you if that's the case, so that we can partner and actually help each other. Welcome to CAMPA. Below your screen, those are the details which you need to key in case you want to be part of CAMPA. Qualifications of being a CAMPA member are simple. You just need to be a healthcare provider. If you are a healthcare provider, regardless of the specialty which you are in, then CAMPA is your home. come join us. Let's give back to the community together as a unit, as a team. These two members here, they are very happy today because there is nothing so fulfilling under the sun than touching the life of someone who doesn't have something, right guys?
Sure.
So let's embrace that spirit, and we are calling upon also the general public and also the well-wishers outside there. If you are a person who believes in the cause of giving back, Kampa is actually calling upon you, is actually requesting you to come on board. You can come help us by giving us contributions or by sponsoring some of the activities that we partake. Things like medical camps, of course. We need people like pharmaceutical companies, we need people like optical companies, we need dentists. Whichever company you are in, we are calling upon you to come on board, support us in whichever way you can. Whenever we are doing our outreach programs outside there and going to those interior areas, we need people like Bidco, we need people like whichever company you are and you are dealing with food stuffs, please, we are calling upon you, join us in this campaign. Let's go feed the hungry in the streets. Let's go feed the hungry in the slums, also in those interior areas. So Kampa welcomes sponsors, well-wishers and partners to join us so that we can actually make Kampa shine, rise and do the Lord's work in this endeavor. So guys, that's just a nutshell about Kampa. Many more will be brought to you. So as we end the show, I want to allow the host to actually close for us the show. Any parting shot that you have for us, you can actually tell members and viewers there, how do they find Healthcare, where is Healthcare located and such stuff, so that whenever they want to seek optical services, they are always welcome here.
Thank you so much. Hillcrest Opticians, we are in Tegela town. Yes. Directly opposite Giza Tegela. We are located in a building called Marshville Hub, first floor, room J1. Our telephone number is 0725 531 407. We also have Airtel number 0731 905 920. I'll repeat again, 0725 531 407. Airtel number 0731 905 920. Thank you so much, Bwana Treasury and also SG for today. I feel so much humbled to have you guys today at Hillcrest Opticians. To our viewers, what I can say, here in together we normally have a lot of also dry eye symptoms. For those people who might have problems that they don't know where to go for help, you can visit us for screening also. We do free eye screening. Wow. Yes, for school-going children. We do it for free. Wow. But for other people, we have a 300 consultation fee. Wow. But it's only paid once. Once you pay 300, there is no any other day. You just register with that 300. After registration with 300, anytime you walk in again at Hillcrest Opticians, you don't need to pay again. You only need a consultation of 300, a one-time payment of 300 shillings. Wow. After that, there is no any other amount. So, as I said earlier, our services remain refraction, dispensing of spectacles, that is for short-sightedness, long-sightedness, and astigmatism. For those people who might have eye problem but they don't know where to run to, we welcome you at Hillcrest Opticians to Tegela. Thank you.
Thank you guys. I think that should be it for the show, but as we